one of the things that we know about the virus is that many people get it and have a mild case of it. But we also know that some people are going to be severely impacted by it. And so I have a gentleman here today to come up and talk about his battle with coronavirus, to talk a little bit about that. Also, we know, for example, Senator Mosier had a case of coronavirus that was very serious. He was hospitalized and really, put his health in a precarious status. So we know that if you get the virus, you can be severely impacted by this. And it doesn't necessarily matter how old you are, though we do know that if you're older with underlying healthcare conditions, you're more at risk. And those folks should take more care, more caution. Kurth Brashear is here to talk about his fight with coronavirus to really help us understand how severe this can be for somebody who is in good health. So Kurth is the, I'm sorry, let me get your title right, Vice President for Institutional Advancement at and Coronavirus Survivor at Concordia University. So Kurth, if I could ask you to come up and talk a little about your fight.
Sure. Good morning, and thank you, Governor, for the invitation to be here and share my experience. As the Governor mentioned, I live in Seward with my family, and we've been following the state's guidance throughout this pandemic. We've been wearing masks in public. My wife and I, our employers require masks at our places of work. Our children's school is face-to-face and requiring masks as well. And we've really limited our face-to-face interactions with others. I say that all as predicate for sharing this story, that in September, we had some friends over to our house. We let, as you'll hear me say, our guard down a little bit. These were families with, a few families with kids who go to school with our kids, so they've been masked together all the time. At that time, cases in Seward were not very high, and much of what we were going to be doing was outside. September 24th, after this event, we were notified that 2 of the people who were there had tested positive for COVID. And my wife and I immediately left our places of work. We picked up our kids and began our quarantine as Four Corners Health Department had directed. That same day, I began to have some symptoms, mild, cough, tightness in my chest. And for me, that happens often during harvest season in Seward County, and so I didn't really think much about it. But my symptoms increased over the next several days, and on September 30th, I woke up with a fever, which is unusual for me. I'd had chills a couple nights. My breathing continued to be a problem, and so I was approved for a rapid test at Seward Hospital, and that came back for COVID. So I went into isolation from the rest of my family. They continued in quarantine. Of course, now we were more concerned even if they had it as well. And so they were tested on October 2nd with Test Nebraska. They came back on October 5th that they were negative, for which we thank God. My symptoms worsened. I had coughing, shortness of breath, significant back pain, fatigue, and my blood oxygen levels were lower than they should be normally. And on October 4th, my blood oxygen levels were reading with the pulse oximeter we'd bought in the mid-80s. A good friend of mine who's a doctor at Duke University in North Carolina, who's been treating COVID patients there, urged me to go to the hospital. And he said really what he'd been seeing was patients at Duke who would experience a rapid decline if they were having oxygen issues. And so we went to Bryan East at that time. My wife took me. They went through a battery of tests for me, as well as a CAT scan to view my lungs. Thankfully, my blood oxygen had stabilized. The test came back normal for COVID, I guess, or at least not concerning. But they also shared with me that I had lung damage. The CAT scan had depicted that I had what they call ground glass in my lungs, which does not sound like any kind of fun overall. They gave me some treatment, sent me home. I will say those next 12 hours were the low point for me in my time. But I did begin to see improvement on October 5th and throughout, and I was out of isolation on October 9th. My family continued in quarantine until October 15th, and thankfully never developed symptoms. I'm told that my lung damage will heal itself over the next several months as much as anybody can say that. I certainly hope that is true. Several weeks after this, as I shared with the governor this morning, I continue to have joint pain, especially in my back. Not debilitating, but certainly persistent. I continue to need to catch my breath after prolonged exertion. Thankfully, the fatigue ended a little bit earlier. I appreciate the governor inviting me again to share my story, which I would submit is representative of many of those who have COVID in our communities and state. Too much public discussion, in my view, is focused on, regrettably, understandably, tragically, the 2% in our nation who have died from COVID. And each one of those is indeed a tragedy. But I think it creates the impression that the other 98% are fine. We use the term recovered. Well, if recovered means lung damage that we all hope will heal itself and lingering back pain, I'm not sure that that's my definition of recovered. And if I understand, I'm no medical expert, but the studies that are out there say somewhere between 60 to 80% of people who get COVID have symptoms, ranging from very mild to what I've experienced, which is not as severe as many, to the 20% who might need oxygen or a ventilator or be put in the hospital. Then I think we need to start talking about the 60 to 80% of COVID patients who have symptoms and whose health is impacted by getting COVID, as we talk about that. That would mean, in my rough math, 50 to 65,000 Nebraskans have probably had symptoms of those who've had COVID already, of some kind. Thankfully, our death percentage is much lower. But I hope thinking about that, COVID in that way, would help us think about this pandemic a little bit differently. My encouragement is don't let your guard down. It's not about living in fear. It's about simply taking the protocols that have been talked about, the governor's mentioned throughout, to go through this. Take steps to protect yourselves and the loved ones that you care about. Protect the loved ones you don't care about as well. Wear masks. They don't keep you, I will tell you from our experience, from doing anything. We're going to work, we're going to school, we're taking takeout food from the restaurants in Seward to support our local businesses. We're shopping as we've done before, but we wear masks when we're out in public. And yes, we have changed how we handle things at our house if we have people come over. It's understandable, I think, for all of us that we want COVID to be black and white. I would submit this virus isn't that cooperative. Of the 5 members in my family, I was around the 2 people in our home infected the least amount of time, about 30 minutes total probably of what would be defined as close contact. The rest of my family was around them more. They didn't get it. We were quarantined together before I went into isolation for 6 days. My family didn't get it. Again, I thank God for that. And those who do get it, we can't predict what their symptoms are going to be. Whether they're going to go to the hospital, whether they're going to be like mine, whether they'll be asymptomatic, or whether they will die. There is no rhyme or reason to COVID in my view, so I would encourage us to take it seriously. Don't let our guard down. I'm a proud Nebraskan. Some would even say I'm obnoxious about being from Nebraska. I'm proud of the fact that we've always been focused as Nebraskans on ourselves and our communities first. What makes the good life great is that we help each other when we're in need. We see it demonstrated all the time. We don't look to the government first, we look to ourselves and our neighbors. We saw that in 2019 in the floods. We see that when the farmer loses his harvest equipment before the harvest. We've seen that in my community recently with a tragic fire and the untimely death of a young child, where our communities come together and support one another. So I hope that we will, as we have always done throughout our history, and I would encourage my fellow Nebraskans to look out for one another, to look out for ourselves, to do the things we need to do to stop COVID from happening. I would not wish, even at my mild, whatever level you want to categorize it as, I would not wish what I went through on people I don't like, much less those I care about. And so I hope we'll all take the appropriate steps to stop this now. Thank you very much, Governor.